Yeah, like that's what we talk about. When these communities are going to be hurt the most, it's going to be the poorest of the poor communities, the most disadvantaged, the people with the least amount of funds to deal with the situation, and they're not going to be able to have any resources to, like seek help. Pretty much, like they're not going to be able to come in very easily. They're not going to go to the top doctor in the world or whatever. Like they're probably going to if they have access to a doctor and actually pay for it, like when medical care is necessary, in a massive way, it's not going to be them getting the best, like the poorest of the country. Like they're not going to be in the best shake out of it. Like it's going to be uneven treatment in terms of how we respond to this virus here. Like it's going to be completely uneven treatment. And that is really kind of the case that a lot of these more progressive senators are making here for Medicare for All. So he says, let me be clear. It has never been more important to finally guarantee health care as human right by passing Medicare for All, said Sanders in a statement announcing Health and Human Services Secretary Alex Azar's for refusing to guarantee that a vaccine against the disease would be affordable to all Americans. That was pretty insane. Like if the virus does come up and the vaccine does come up, I don't know, maybe all Americans wouldn't be able to afford it. Like that when it comes to ideas of public health, there is such disparity on who can access what and what cures are available to everyone. That's just not right. It's just not right. Like we have had people, like the guy who invented the polio virus, his name is Jonas Salk, is like, yeah, let's make it available to everybody because it's a public. Like I did this for the public is pretty much what he's saying. Like and that's a symptom of one thing. That's a symptom of capitalism and greed gone crazy. A number of critics on social media wrote that the outbreak, in which at least 60 Americans have so far contracted the respiratory illness and more than 82,000 people have worldwide, should cause any Medicare for All skeptic to reconsider their position that the government should not guarantee healthcare to all Americans that would be free at the point of delivery, as it is in most industrialized countries. The spread of the coronavirus makes one of the strongest cases for why we urgently need Medicare for All, tweeted Representative Mark Pocan. If folks can't afford to get tested or treated, how do we manage the spread of disease? Like, we need people to get not just tested, but tested easily and make sure that they are able to come in and get a test that is affordable, easy, quick, accessible. You know the drill. So, like, if we are not able to do that as a country, then what are we doing here? It's an excellent point there by Pocan, and something that a lot of Medicare for All advocates have been making. If you're a skeptic of Medicare for All, try this. Take note of the people who come within infecting distance of you. Wrote author and MSNBC contributor Anand Girardis. Are you confident that they all have access to the care that they need to be healthy and keep you healthy? Like, think about, especially if you live in like a big city, the people that you come in with infecting, within distance of infecting, like each and every day. Like, do they all have access to a doctor that you would be comfortable with? Because when there's a public health crisis like this, like that's a legitimate question. It's something that I think people are going to be worried about. Like, and people should be worried about. And under Medicare for All, they would have access to that. So very, very important. So, if not, become interested in what could change that, he says. What could change that? Coronavirus makes clear what's been true all along, added Gerardis. Your health is as safe as that of the worst insured, worst cared for person in your society. If you decide that'll be the height of the floor, it will be decided by the height of the floor, not the ceiling. Yeah, it's kind of the idea of the lowest common denominator. It's really kind of the idea of just the lowest common denominator, the person who is least cared for, and if you don't have a quality standard of care that exists for everybody, like that's going to spread. That's really going to spread. Matt Iglesias tweeted, it seems like even if you personally have a very robust health insurance plan, there might be an upside to living in a society where other people could get their coronavirus symptoms checked out and treated without fear they'd be risking bankruptcy. I mean, that may be maybe just a good idea. Even people who have employer-based health insurance are likely to skip seeing a doctor if they feel ill. So New York Times reporter Sarah Cliff, especially at the beginning of the year when people have likely not met their insurance deductible, allowing their coverage to kick in. That's the problem with that. We have a lot of academic research showing high deductibles make patients reticent to seek care even when they need it, tweeted Cliff. Yeah, sounds about right. And that's a story for something that has been very, very, I think, well reported. Like we've heard a lot of stories about people like not going to the doctor because they didn't have access to, or they didn't have their insurance. Like they couldn't pay the price of getting sick. Like it was just too much for them to really to bear. But as columnist Helene Olen wrote Wednesday in the Washington Post, the Kaiser Family Foundation reports that more than half of Americans with employer-based health insurance have a deductible of at least $1,000. So that means they have to pay that deductible, for those of you who may be listening out of the country, for the health care to kick in. For people who obtain insurance through the ACA, the average deductible is about $4,000. Virus and infectious diseases. Don't check your deductibles, copays, or network access before they strike. Wrote Olen, doubters may claim that our nation can afford Medicare for all, but it's increasingly likely that we are about to discover just how costly our current system is. Because, I mean, it's spreading like wildfire in places like Italy, where you can, even if you're one of the poorest people in your neighborhood, go right into a doctor, get checked, get tested, get cured, whatever. To the best that you can be, anyway. And just pretty much deal with your situation. Like, you can deal with your situation, and most importantly, at a low cost to you. Free at the point of delivery. Huge deal there. But not in America. Like, and I really don't want to be around. And that starts to spread like absolute wildfire. And things get really, really serious in America. And we have a lot of people who don't want to go to the doctor. They don't want to pay the price, even if they do have good health insurance. Because many Americans tend to ignore their symptoms to avoid a costly medical bill. Millions are likely to go to work even if they're feeling sick, making the spread of the coronavirus even more likely. While other industrialized countries require that employers offer a wide range of paid sick days, it's a big, big part of it. With all countries in a 2009 study by the Center for Economic Policy Research, offering at least 9 days with full pay. The U.S. does not require paid sick time for any workers. Like, no sick time, no paid sick time required. So that's going to make people with coronavirus just be like, you know what, it's probably nothing. I'll probably be gone by tomorrow. I definitely don't have the coronavirus. It'll be perfectly all right. Like, I'm good to go into work. If I don't, I'm going to lose a day's paycheck. Like, that'll suck, especially if you're in a very hard job, a very kind of crappy company that doesn't give you a lot of benefits. That's a very rational decision that probably a lot of Americans are going to be making if this thing gets bad. On average, Americans who don't have paid sick days are entitled, who do have paid sick days are entitled up to 7 days per year, according to the Bureau of Labor Statistics. However, 4 in 10 workers, 43.5 million people, don't have paid sick leave. And 7 days, by the way, probably not enough to recover from the coronavirus. Representative Alexandria Ocasio-Cortez tweeted, "I used to work in the food industry. I can tell you how many times the people who handle your food, who are already overworked and underpaid, show up sick to work because our country refuses to guarantee health care or paid sick leave. We need Medicare for all." She's right about that. She's absolutely right about that. This is definitely a great point. Many Americans, most likely to ignore symptoms, they feel lack both paid sick leave and health insurance that would allow them to afford testing treatment for coronavirus, as well as unemployment insurance or other assistance if they're unable to work, former Labor Secretary Robert Reich wrote. They will ignore this stuff if they don't have sick leave, good health insurance, unemployment insurance, eligibility for food stamps, Medicaid, or public assistance unless they work. So yeah, that's probably going to be most Americans. It's just the reality of the situation. So think about the if you're well off, if you're in a good position to get tested for the coronavirus, think about the people around you who are going to be either going to work sick, or going bankrupt if the coronavirus gets bad. And something, by the way, that they probably do already, whether coronavirus is coming or not, but just in slightly smaller proportions. Yeah, so that seems to be it's pretty much what's going on with coronavirus. I'm just personally chilling, putting my feet up, enjoying my last coronavirus-free days before things really get serious here. But let's turn to the Democratic primary. Well, I'll say things have gotten serious. House Speaker Nancy Pelosi and Senator Chuck Schumer, the minority leader, hear constant warnings from allies about congressional losses in November in the party if the party nominates Bernie Sanders as president, which, by the way, from what I've heard, when I've talked to the people that I've seen on Twitter that have no blatant bias against Bernie Sanders, and the people actually analyze this stuff, nobody has any evidence that actually Bernie Sanders will be a albatross in the party and down ballot races. Where they always say, they said that about Trump, and boy, it wasn't, was it? And this is a talking point used, again, with no evidence by people who just want nothing but to see Bernie fail. Insane article. I think that really represents most of what the establishment at this point is thinking. In the New York Times, David Brooks coming out and saying, no, not Bernie, never Bernie. That is the establishment position on this. Not Bernie, never Bernie, not going to happen. We will lay down the line on this one. I think this is really going to finally expose the true nature of the Democratic Party this summer in Milwaukee. It's going to be crazy as hell, so buckle up your seatbelts for that, because if we do get to a broker convention, which is certainly possible, I think it's actually probably more likely than not at this point that we get to a broker convention and an attempt to steal it from Bernie Sanders is made. And when that does happen, the true nature of a lot of people are going to be revealed. It's pretty much going to be time to put up or shut up. I know people are going to be putting up for people we probably don't want them to put up for. So just get ready for that. Democratic House members share their Sanders fears on text message chains. Bill Clinton calls with old friends events about the party getting wiped out in the general election, which is very, very funny considering he literally was helping run the campaign of the candidate that already lost to Trump, lost the Senate, lost the House, lost everything. You cannot do much worse if you're the Democratic Party than what you did in 2016. So I don't want to hear jack from Bill Clinton about getting wiped out of the party. That is ridiculous to me that he even thinks to say that about complaining about someone else screwing the party over. Talk to your wife. Literally talk to your wife, who's, by the way, going to be starting a podcast now. We got some competition on the scene, apparently. So anyway, dozens of interviews with Democratic establishment leaders this week, as again, reporting from the New York Times here, that they show that they're not just worried about Sanders' candidacy, but are also willing to risk intra-party damage. Oh, you think there's intra-party damage is what's going to happen? No, it's going to be no party. I don't think these people, they understand. They're openly plotting the death of the Democratic Party. It's just that simple. It's just that simple. There will be no Democratic Party. Trump will be reelected if the nomination is stolen from Bernie Sanders. You heard my father on the last episode, or 2 episodes, however many episodes it was ago. He is not a Bernie Sanders supporter, but he is told that, he's kind of a guy who's, again, he was most politically aligned with Joe Biden. This is not a guy who's very sympathetic to anything Bernie Sanders says. He was I think, was least agreed to in that poll that they took for the candidate that supports him the most. But he said to me, the one thing I just don't want is for them to steal it from Bernie. That is the signing the death warrants on the Democratic Party, the death certificate, sending Trump right back to re-election. If they try to put, who are they going to put up? Who are they going to put up? I just can't think of a name that will get broad-based popular support. It's insane. Anyway, such a situation may result in a broker convention, a messy political battle, which the likes of which the Democrats have not seen since 1952, when the nominee was former President Adlai Stevenson. No, just kidding. He wasn't a former president because brokered conventions produce losers. Good contentious primaries produce winners. And that's what